Hello, I'm Robert, fact checker and science blogger, helping people who are scared of many things. And this time it's to help people who are scared of this new variant. And just want to say, just looking at this diagram again, I talked about before, but if you look at it, the two regions with the highest transmissibility, then they had almost none of the new variant, indeed possibly none. So whether or not there is an increase in transmissibility of the new variant, you see all this scatter, it's absolutely clear that the public health measures are far more important than whatever the new variant does. And if you have good compliance with public, look at that spread from there all the way down to there. Some regions, right down there, if I can see them. So, and there's absolutely no doubt that that's why it's spreading, and that's why it's spreading so fast in the United Kingdom. The new strain, it does not seem to be more severe. There's no evidence of that yet. It does not seem to evade the vaccines, and you wouldn't expect it to. It can be detected with the same tests. There's just one channel lost on one of the tests. You can still detect it. It is one of many strains. It is transmitted in the same way as the other strains, and you protect yourself in exactly the same way. Through physical distancing, wearing masks, isolation if you are a case, quarantine if you are a contact. And there's some evidence that suggests it may be slightly more transmissible, and they don't know how much. So, it will take a month or so. You have to be patient, but science takes time. Take a month or so to know. The travel bans never made any sense, because it was been circulating in the United Kingdom since September. If it really is so much more transmissible, even if it started in the United Kingdom, it must be in the whole world by now, in at least small levels. And it is being found everywhere in many different countries. The reason we found it in the United Kingdom before anywhere else is because we do more full genome tests in the United Kingdom of sequencing the entire genome than in the rest of the world put together. More of that is done in the United Kingdom than in the whole of the rest of the world. So it's no surprise that we would discover something like this here first. It doesn't even mean it started here. It's not the first time that there's been a variant that has spread like this. This is D614G, and you see from February to March, it really spread over most of the world, and hiccuped a bit, then gradually spread and eventually became the most dominant one in the world. And that was a similar thing. The science is still out. I'm not sure they've quite decided it yet, but it may be a bit more transmissible than the others. On the other hand, it could be other reasons. They suggested for D614G it could be more transmissible from cell to cell rather than from human to human. And this is not just one of the many, so they have to investigate this very carefully. They have to investigate it, but they also looked at whether it was caused by accidents of super spreading, and that can happen, and just accidentally. Some strain has eventually is likely to dominate when you've got lots of them, and if they just through random walk kind of situation, then you can end up and just they happen to be super spreading in a particular area that happens to lead to lots of index cases, like people coming back from Spain on their holidays to the United Kingdom, and then they super spread back in the United Kingdom with the Spanish strain. So that sort of thing can happen too. It's very hard to disentangle. They use animal models, but the animal models are not exact copies. None of them are of what happens with humans. So even animal models don't really solve it completely. They just give hints. These are some of the other ones. D614G, Cluster S, that's the British one. There's another one, and that's Maria van Kerkhove looking at the in a tweet on 27th. That's today. And so it's not known if it's more transmissible, and it makes no difference to public policy either way. The travel bans never made any sense. You can't stop this variant with a travel ban. If it is more transmissible, then it'll be off doing its thing. And the way to stop it is to stop everything. You can't stop a particular variant when it's mixed up. It's not likely to succeed. Because if it is that transmissible, it already will have spread if you're not containing the virus. You've got to contain the virus, and then you can stop all the strains. And so we know how to do it all. So make sure that you, if you haven't done it yet, find out how to wear a face mask properly. Look up the World Health Organization advice. Don't just copy what other people around you are doing, because most people are using it very incorrectly. Luckily, a very sloppy use of the mask still works, and that was quite a surprise. But it's better to do it properly. For instance, you never touch the front of the mask, and yet just about everyone does. Just on television, I've hardly seen anyone, public figure or anyone, who doesn't touch the front of the mask, except very careful doctors and health workers. So most people don't even know that, I think. You can do the contact tracing yourself. You can do physical distancing. You can tell your contacts if you are a positive case. You don't need to wait for the contact tracers. Find out the situation in which you should tell your contacts and then tell them. Because the contact tracers are way overwhelmed, and this will help your contacts to quarantine before they infect their family. And they should want to know if it's properly understood, or at least let them know and let them make their own decision, and try to point them in the direction of the good information. Do the physical distancing. It should be absolutely automatic. Always wash your hands. Learn how to wash your hands thoroughly. Look that up. Spend just 10 minutes of your day looking up how to do all these things, and learn how to do the quarantine properly if that applies to you. And it's well worth doing that. And then once you've learned it and once it's become a habit, then that's it with you for the rest of of the pandemic, for as long as you need to do it. And I come across from time to time people who think, oh, it's nothing. They're so influenced by people. We are herd animals. We are naturally influenced by others. When lots of all your friends are just not treating it seriously, when you see on television people not treating it seriously, the journalists have made a big thing about how many people in the United States are not treating it seriously. I can say from my own experience of talking to people in the United States who are very scared of this virus and taking great care, that there are vast numbers of people in the United States who are taking it very seriously, but they don't appear on television. For several months, our television screens have been full of people who don't take it seriously, and it's no wonder that this has had an influence on people around the world, and that in many different countries, not just the United States, every day they watch television and they see crowds of people not physically distancing and not wearing masks on the TV news. That has an effect. It's no wonder that many people don't take it seriously when journalists focus right in and only talk about the people who are not taking it seriously and make that the big news story of the day. I expect this to change with Biden, because he's going to be on TV all the time saying it's serious, and you've got to look after, take care. So I gave this example here that in the United States, so far 1 in 1,000 people have died of COVID. If everyone in the United States did one base jump, then it would be 1 in 2,000. So more people have died in the United States than if everyone in the United States did a base jump, a single base jump. Most people in the United States would not do a base jump. So I think maybe that helps put it in perspective. And then and in some areas of the United States is much higher. It's even twice as high as if everyone did a base jump, as if everyone did. But there's also some areas in the United States it's 1 in 200 have died, and probably areas where it's more of an elderly population, and that's nowhere near the end, because that was with 1 in 8 infected or something like that. You have 1 in 500 died with 1 in 20 infected. So obviously got a long way to go. And even if you're underestimating the number of infected, this is a serious disease. Do take it seriously. And if you're young, then there are thousands. If you've got a million people, for every million people who are infected, there will likely be 100,000 people who have been sick for months because of long COVID. And a certain percent, tens of thousands, would be are likely to probably still sick ever since the beginning of the pandemic. And we don't know for sure. With SARS, then some of the people who got SARS still had detectable effects on their bodies years later. Effects that would make a difference between being an elite athlete and a mediocre hobbyist athlete, being an Olympic medalist and someone who just runs for a hobby, and you're better than their friends, but no way that they could compete in the Olympics. This is the, if you think of yourself as a young fit person, then instead of thinking, oh, I'm immune from COVID, you should think, what will I be like if that I could get a serious hit on this fitness that I'm so proud of? Will I feel the same if I have months when it's, and losing your sense of taste? If you're a cook or something, if you're keen on cooking, what's it going to be like to lose your sense of taste for 3 months, say? Or things that you like are going to taste horrid. And it's just really quite difficult even to eat things you know are nutritious because they don't taste nice. I mean, there are lots of reasons to motivate yourself and then think about you protecting others from all this. So, sadly in the UK, many people are not physically distancing, especially out of doors. You should do it outdoors as well as in. Very sadly, this thing about ventilation has led people to thinking, if we have good ventilation out of doors, it doesn't matter how close you are. That's not true. The big droplets can go to another person within 1 metre just as easily outdoors as indoors. If you had a very strong breeze, maybe you could shorten it, but it doesn't make sense. Always just be automatic, always, no matter what. Don't try judging the breeze and say, could I be 3/4 of a metre because it's a bit windy. Just always automatically step back 1 metre, or if in your country they expect you to step back 2 metres, do that. Whatever people expect. It doesn't seem like it makes much difference, but do either the 1 or the 2 metres outdoors and indoors. Be the stepping back person. And if you make it automatic, if it's an automatic habit, then you won't get COVID fatigue. I don't know why people aren't making this clearer, but you get an implementation intention. You never get tired of crossing the road, of looking both ways. If you live in a city, unless you're very reckless, and if you're crossing busy roads frequently, you will always be looking both ways before you cross the road as an automatic habit. Where I am, out in the countryside, even there, then people do this. They do look both ways, even if you're crossing a road where there's only 1 or 2 cars pass by every hour, or sometimes only a few a day. And if you've got that habit, you will look just in case. And if you do that for cars, then you should do that with COVID. Make it totally automatic. And even if I could hear a car if it was half a mile away, but you still do it because it's just your habit, and it doesn't make sense to not do that habit when you're crossing a road, even if you could hear a car quite easily. And so, with then looking at the physical distancing is much better than a vaccine. And if you do the physical distancing, then you've pretty much eliminated the risk. That is how the World Health Organization protect themselves. That's how health workers, they use their masks, clinical masks for droplet protection, but they are not doing aerosol protection in a general COVID ward. Essentially, they're doing the same as physical distancing. If you walk through a COVID ward and you're kept 1 metre away from all the patients there, then you would be protected from their droplets in the same way that the nurses are when they go up close and they've got their visors on and everything and all their gear. It's the same kind of protection. It's very effective. So that's much better than a vaccine. A vaccine reduces your risk of infection 20-fold, and physical distancing pretty much eliminates it. It's as safe as crossing the road and looking both ways. And so, and also be sure to isolate from your own household, and right away if you get COVID symptoms, even before you get the test result, while you're waiting for your test. In China, they got the time in January, before they had rapid tests, they got the time to get yourself tested down to 4 hours. So in Wuhan, people would go into the hospital and then a full PCR test. They would do it in 4 hours. They'd just wait there for their test. If they got COVID-19, they immediately isolated them. They didn't want them to go back into the community again. And even if they're very mild cases, even if they haven't got any symptoms yet, then immediately isolate. And they isolated them away from their family in a proper ward. and that's why they had very large wards in stadiums. We're not doing this here, but look up what the World Health Organization say about how to isolate properly, and you should be isolating as well as if you were a patient in a COVID ward, and the rest of your people in your household should be treating you like health workers do in a COVID ward, as far as they possibly can. That's the only thing that makes sense for this disease. So you do the very best approximation you can, and the World Health Organization have advice about how to do it. Basically wearing a clinical mask, post-wear clinical mask, physical distancing, various other things you do, and you're close to the level of protection that health workers have in a COVID ward without having all the full gear that you put on. And 80% of the spread is in households, so you must isolate away from or quarantine away from your own households. And if you just quarantine as a household and don't quarantine away from other households, you're only stopping a fifth of the spread. If you can do the isolation and quarantine of the household away from your household, you're helping to stop the other 4/5 of the spread. And so it'll go down much faster if people do that. And in the United Kingdom, people are just not doing that. And they don't even understand that isolating straight away as soon as you have symptoms while waiting for results, and quarantine straight away as soon as you know you're a contact, and telling your friends straight away as soon as you are a case, and if they fit the amount of proximity that is necessary for a contact over the time period of 2 days before, 15 minutes proximity within 1 metre within 1 metre and without taking the full precautions of a health worker, then in that situation they should know, because they can protect all their contacts. So that's it. Most don't know. I've got a link there. You can find out more about that. And then the effectiveness of vaccines, if you look at this big complex spike, and there's so many regions that the spike protein can target, on the spike protein, all these are needed. It's like a big complex clockwork machine. And you may well know it. If you've got one of the old clocks with lots of cogs and wheels, you just put something into the. If you open up and look at the network, at the mechanism, you can just plug something in anywhere, it'll stop. You don't need to. There's not one particular cog you've got to stop. And the spike is very like that. That almost any of these spots, there are lots and lots of spots on it, and if the antibodies just latch onto one of those, they'll mess up the complex machinery that's needed to get into a cell. And so there are lots and lots of little spots that the antibodies latch onto, and this gradual drift that we're getting with new variants, it's only going to change one little spot somewhere, or maybe a couple of little spots, and there'll be loads and loads of other places that the antibodies that your body generates in response to the spikes in the vaccine will still work against the variants of the virus. So they do not expect anything except maybe a kind of slight knock-on effect that, instead of that one of your maybe you've got 5 or 6 different antibodies attacking it, one of them is affected, so you've got a sixth reduction, say, in your antibodies, or however many antibodies you have, and it's probably more than that, and you so you've got maybe 1 or 2 of them are no longer doing anything with this new variant, but you've got all the others, and the body will just keep on making the other ones, and so it'll still stop it with pretty much the same percentage, whatever it is. Like if it's 95%, then it's only going to be a hit of a percentage or so, probably, if you've got one of the antibodies not recognizing the virus. And but they do care about this. They monitor very closely the virus escape, and over a period of years, then it will escape. This is, with flu, it happens over months. With measles and mumps and things like that, it happens over decades. It doesn't even happen over decades. It's 1971 for the MMR vaccine, I think, and the polio one goes back to the 1950s, and both of those are just as effective now as they were back then. So for those, not even over decades, it doesn't change. With COVID, it's between the two. If it's like other coronaviruses, they obviously have to keep studying it, but with other coronaviruses, they tend to escape the immunity over a period of multiple years, but not over months. And these are coronaviruses widely spreading in the community, our common colds, a quarter of our common colds. So they do think that it would eventually escape over years, but it's not likely to escape the vaccines over the short time scale that we expect to eliminate it from 2020 to 2021 to hopefully eliminate. We could eliminate in 2021 with a very robust response, or 2022. So over those timescales, then it's not likely, but they do have to keep monitoring it. And the more we are sort of spreading it as fast as possible, and the more, especially if we do the poor public health protection measures, so you get multiple viruses coming in, and then you're not being treated, and you're just staying at home with the virus and so on. The more we're doing this sort of stuff, then the more we are actually encouraging it to try and escape the protection of the vaccine, even once you've got a vaccine. So once we've got the vaccine, we've got to keep on doing everything, and the more we do it now, the more we're making things, the more we're creating conditions for the virus to spread and to compete and multiply, and for the fittest viruses to survive, and especially also people who have it at home for long periods of time if they're immunocompromised, or some people getting reinfected because of so much community spread, and not everyone is protected against reinfection by natural immunity. And the more all that goes on, then the more we're creating conditions where it can mutate a little bit faster. The vaccines may become a little bit less effective more quickly, even if they don't lose all effectiveness. They can gradually lose some of their effectiveness. So the vaccines should continue to work, and it's very unlikely they do stop working next year, but they do have to monitor it, and that's basically what's happening here. And we've got to keep on doing everything as the vaccine comes down. But if it really does come to it, that they need to, then this spike protein can be replaced. They can snip off. They can make a new vaccine in days, and then they would have to be checking that it works okay and everything, which would take longer. But you don't need to worry about, and then you'd have to revaccinate people if it's spreading around amongst vaccinated people. So it'd be a big palaver, and we don't want that to happen. But it's not going to happen suddenly with one mutant, and if we keep on really working hard, then we can keep it down, and we're totally very much reducing this. And then you get people saying, oh, it's going to take so long to roll out the virus. I think we're going to be very surprised in 2021. I think, just as New Zealand was, I think the United States is going to surprise itself. I talked about earlier about how we've had this kind of self-propaganda of watching television and seeing huge crowds not physically distancing and not mask wearing. We don't have that anymore. That's already stopped. And so that's going to be happening already gradually over weeks and months. And then in January, we're going to have Biden after his inauguration day. He's going to be like Jacinda Ardern. He's going to be on TV telling the United States people, and because of his influence and because it's so much publicized, it's going to affect the whole world of those, especially Latin America, Europe, people that very much look up to the United States. Then they're going to see Biden there telling the world just like Jacinda Ardern did. And if you've watched some of Jacinda Ardern's speeches, and you understand why she was so effective in influencing the New Zealanders to follow these measures, she communicated very clearly and precisely to the New Zealand people what the situation is and what they need to do, and that they needed patience. It was going to go up, it's going to go down again. I think even she was probably surprised about how effective and how quickly it came down. And you get people saying, oh, Britain can never do it. I know Britain's an island and New Zealand's an island, but we're too close to Europe. And they say, Europe can't do it because we're not Asian and we're not an island. And we get all these people just saying, we can't do it. But what they have to do, what none of them are doing, is copying what New Zealand did, precisely and clearly, and seeing if it works. And it's enough with all these excuses. We should do what they're doing. Boris Johnson, I'm in the United Kingdom, should be on the phone to Jacinda Ardern right now saying, how did you do it? Also to Taiwan, also to China, also to Laos, also to Vietnam, to everyone who's done it. He should be asking them, how did you do it? We haven't managed to do it yet. How did you do it? What can we do? What can we learn from you? That's what we should be doing. And we're not. Instead, we're reinventing the wheel and making square wheels. And the wheels go bump, 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 bump down the road. And we're driving around in our square wheels when other people made up these round wheels. And we are having to learn that wheels need to be round from scratch. That's basically what we're doing in the United Kingdom. And the reason we've got square wheels for COVID is because our muscle memory is flu. And you've got to change your mindset to do COVID. China's muscle memory was SARS, so was Taiwan's. So they had a head start. So they had round wheels from the get-go. But we had square wheels from the get-go. And we're chunking away down the road and using enormously expensive measures of lockdowns in place of these very fast, effective measures that brought down New Zealand cases tenfold in 25 days. And think what that would do to the United Kingdom or to the United States if every 10 days, every 25 days, the cases per day were going down tenfold. This is something you can do. We can do it. So we wait for our government, but until our government does it, we can do it ourselves. So in your own community, you can be doing that. You can be the person in your community who stops it, who influences other people in your community to also do it. And any community that does this should see the same success as New Zealand. They should see it coming down tenfold in their own community if they can manage to influence enough people in the same way that Jacinda Ardern did. If you can, because you don't even need the contact tracers. You can do your own contact tracing, as I explained. You do need the testing, but we do have reasonably adequate testing in many places. We've got reasonably adequate testing and an engaged community, and if there's sufficient clear explanation within the community, clear communication, then any community can achieve this, even without at the top. But the World Health Organization say that for the best effect, you need all of government, all of society approach. They've been saying that since February, I think. I mean, all of government, all of society, quarantine politics, work together, and that's how we're going to stop this. I think that with Biden giving a new message in the United States, and the vaccine, then when countries like in the United Kingdom in the summer, just tiny spots were left of COVID at one point, like Leicester, and in Scotland, just a few little super spreading clusters. I think one was in Glasgow, one was in Aberdeen. There was just a few people were spreading it, and then they tried to stop it, and they just weren't effective in stopping it, and it started ballooning and ballooning and ballooning, mainly for things like illegal parties and things as well, which didn't help. When there was these lockdown measures, then people just not following the measures, and it just went up and up. So if they'd be able to come in with vaccination at that point, then that would be a little bit extra bit to push it over. So if you think about it like that, you only probably need to vaccinate a fraction of a percent if you can do everything else with public health measures. And then you have these little lapses, and you're going with vaccination. So you vaccinate the entire city of Leicester 0.5%. You vaccinate, you can vaccinate all of Aberdeen. You can vaccinate the entire region of Glasgow. You're still talking about a fraction of a percent probably. And you don't have to vaccinate 70% or 90% or whatever the latest figure they think it is. I think it's 70% is the most given figure as to how much you'd have to do. But we don't even know. It's spread by super spreading events. And they've never had to stop a disease that spreads in that way through vaccination. I don't think it's an instance of a super spreading disease that spread almost entirely through super spreading events. It's mathematically different. It doesn't work mathematically like the standard herd immunity where you randomly spread it to other people in your community, and they're having to puzzle around, what actually does this mean for herd immunity? And I don't think they know, really. I don't think they really know what figure would count as herd immunity for a disease that spreads mainly through super spreading. They're just guessing, and they're saying, well, maybe it's like the other ones that don't super spread. But if you can manage to targeted vaccination of the super spreaders, then it would be much less than 70%. It just would be a few percent. something like most of the transmission is from 8% of these cases. If we somehow target 8%, or the right 8%, then that would be enough to bring it down. So that's from a study in India. 8% of the cases lead to 60% of the transmission. And then you'd have to do a little bit more over that if you're just doing by vaccination and no physical distancing. But not much more than that. And 71% don't vaccinate to anyone. So if you could find that 30%, but that's of course the big question. We don't know how to find that 30%. But we can target the regions where there's most super spreading going on. And so but then if we are doing everything else as well, then we don't even need whatever is the limit of the herd immunity number for super spreading disease, which we don't really know. And so if we were just doing everything normal and just go back to normal and nobody does anything, we only stop it by vaccination, they don't know what percentage would actually work in that situation. And again, it would be like targeted, unlike most diseases, targeted vaccination in that situation, even if it was almost everywhere. Still, with super spreading, then it's different. You have different strategies, and you could stop it with maybe much less than 70% vaccinated. So anyway, that's just basic overview of the whole thing. The research is very, very early. I'm very interested to see how the research goes. I'm just reading it as a science blogger. I'm not expert on this. I'm just someone who's been following it out of great interest since it began earlier this year. And but I'd be very surprised if we don't get it come down very fast in spring, so long as the with Biden communicating clearly. I see no reason why the United States people should be different from the New Zealand people. It's essentially the same culture, very similar culture, and it's become so politicized in the United States. If we can get rid of that politicization, then I don't see any reason why the United States can't do what New Zealand did. It's such a similar culture, and so if they can manage to build that similarity, that respect from the top, and they can build the community engagement, and if people can really start to take it seriously, then it could come down. So suppose you start on 20th of January, it would keep going up for another couple of weeks, or whatever it's doing. It's actually going down already over most of the United States. So if it's already going down, it continues at that same level for another couple of weeks, and then it'll start going off the cliff, and it will go down tenfold in the next 25 days, then tenfold in the next 25 days, and so on. So if Biden does manage to engage the US people, and even without the vaccine, then the vaccine over about the same time scale will greatly reduce the death rate in the people who are vaccinated. So I think that's a credible scenario. And we'll just have to see what happens. But certainly you can protect yourself, and you can protect your community. And if you can get people around you to do the same things, then they can protect themselves, and then it'll start going down in your community. So anyone can do this in their community, whether or not it manages to go down so quickly in entire countries as we get more engaged with it. And then with the vaccine, then that's like late spring, summer. If it does stay high and they don't manage to keep it down to public health measures, the death rates go down in early spring. So by vaccinating just a few percent, then you can reduce the death rates hugely by vaccinating the vulnerable. That should happen in February, March kind of time, and then the gradually vaccinating everyone should happen through to May, June, July into the summer. And so by mid to end summer, if we don't do it through public health measures, then we'll be pretty much rid of it through vaccination, as long as at least we do our current level of being careful. Then we can expect it to be pretty much over sometimes towards the end of the summer, and then gradually mopping it up in different parts of the world through to 2022. But we could do it faster than that. So anyway, that's That's the impression I get from the people I've been reading about the sort of timescale that we can expect this to start improving in 2021, but it could be much, much faster if we do engage and we can protect our local community. You can always protect yourself, you can always protect your family, make sure they all know. You protect people you know, the community of people you do. If you are at work and they're doing unsafe practices, try and get them to change how they do things. If you are in a job that needs personal protection equipment, you're not being given it, then raise a big stink and say, we need personal protection equipment, and we need to know how to use it, and together we can work at all levels. Don't feel helpless just because you're not in government, you're not able to change government policy. We can always help it. We can all help a few people, and if all of us help a few people, then lots of few people become a lot of people.